answers for it next class. Okay, so next class we'll discuss the answers of what were they correct, what you were supposed to say, and etc. Okay, so I started the recording. So let's begin our first part. So where's my pen? Like this, like this. Okay. So let's begin the salivary glands. We'll talk a little bit more details about them, right? So we have finished with the papilla, that there are 4 types of papilla on the specialized mucosa of the tongue, right? So papilla, they contain the taste buds. So I hope there were no questions there. So let's begin with the salivary glands. So there are 3 major salivary glands. They are called parotid, submandibular, and sublingual, and they are paired. Okay, so they're always going to be paired. So for example, here where my cheeks are, I have 2 parotid salivary glands. Where the angle of the jaw is right here, I'm going to have submandibular, and right under your tongue here, I'm going to have sublingual salivary glands. The minor salivary glands, as the name tells you, they're really, really tiny. So for example, buccal, they're within the cheek. Molar, they're where the molar teeth are. Palatine, lingual, labial is also missing here. Okay, so within your lips, you will also have labial salivary glands. Here we're talking about the embryology of the salivary gland. So where did they come from? I will return to this when we'll talk about the embryo. But if I have to ask you a question like, which germ layer is responsible for giving you salivary glands? What would you say? How many germ layers are there? In embryo, how many germ layers are there? Come on.
3.
There are 3 germ layers. How do you call them? Come on.
Ectoderm.
How do you call the 3 germ layers?
Ectoderm.
Ectoderm. What else?
Mesoderm.
Mesoderm and endoderm. Which one helps you to communicate with the outside world?
Ectoderm.
Ectoderm. Does salivary help you to communicate with the outside world? Well, of course, the saliva is facing your oral cavity. It is within your oral cavity. So of course, it helps you sort of to communicate with the outside world. So this is why salivary glands, they are going to arise from the ectoderm, How exactly? We'll talk about it in embryology. So last semester we have covered it, that how do you call the functional unit of the salivary gland last semester?
Acinus.
Acinus, very good. Okay, so we said that there are some little tiny structures. We usually draw them like this, right? So little tiny sacs. Those sacs consist of epithelial cells, right? So inside of it you can find epithelial cells, and those epithelial cells are responsible for making saliva. How do you call this little tiny structure that makes saliva? You call it acinus. We have discussed last semester that there are 3 types of acini. There is a serous, mucus, and mixed. Do you see mixed acinus physiologically? Do you see it in your salivary gland, or is there some kind of situation going on with the mixed acinus?
An artifact.
Very good. Mixed acinus is not a physiological structure. It is an artifact. It is a mistake of the histologist. Do you remember how do we call it?
Demiluna.
It is serous demilun, right? So one of the name is serous demilun, or what is another name? Another name is the artifact of Giannuzzi. Do you remember this Italian dude that we kind of saw it last semester, right? So Giannuzzi. So this is very important. Mixed acinus is going to be an artifact. It is a mistake. It's not a physiological thing. So in your salivary gland right now, there are 2 types of acini. There are 2 types of secretory units. The first one is called serous. The second one is called mucus. Now, it was last semester. Right now, you're 2nd year medical student. So we're going to modify our answer again. So according to the book, the basic unit of salivary gland is not entirely acinus. Okay, it's not just acinus, it's something else. It's also the thing that comes out of it. And what is coming out from the acinus?
Duct.
Okay, so duct is coming out from the acinus. This duct is going to be emptying into your oral cavity. You need to know that there are 3 types of ducts. The duct that comes out from the acinus directly, so this first part, this is known as the intercalated duct. Okay, so intercalated duct is this one. It comes out from the acinus directly. The next one, right, so this area, this is known as the striated duct. Please add it here. Okay, so here instead of end, it should be striated duct, like striations. And then the last one, this little part, this is known as the excretory duct. So this is a question in the oral, and this is a question in the SAT as well. Okay, so in your first self-control, you will also see this question. What does the basic unit of salivary gland is called? It is called saliva. But what does it mean, basic unit? It means that each of your salivary gland has to have all of the structures that make up saliva. As you can see, I did not write here striated, right? I only wrote acinus, intercalated, and excretory. Where is this part? Well, as you can see, it's not there. Because according to the book that you have, striated part, right? So striated duct is not part of the saliva. Why? Because not every salivary gland has it. But what is saliva? It is a basic unit. What does it mean, basic unit? It means that you have to have it. In order to be salivary gland, you have to have the basic unit, right? But striated duct is not in all of the salivary glands. So this is why, according to the book, it's not part of it. But your department disregards that information. So this is why you need to add here striated. Okay, so you have to add here striated. So it doesn't matter what the book says, according to your department, this is going to be the correct option in your self-control test as well, that striated duct is also going to be part of the saliva. So I repeat the question. How do you call a basic functional unit of the salivary gland?
Saliva.
Saliva. Okay, so you're going to call it saliva. Can you give me the sequence of the saliva? What do we start with?
The acinus.
Acinus. How many types of acini there are physiologically?
2.
2.
2. What are they?
Serous mucus.
Or mucus. That's it. Because mixed is not there physiologically, right? So it is a mistake. Which duct comes from the acinus?
Intercalated.
Intercalated. So this first portion is intercalated. Which one continues?
Striated.
Striated and then excretory. Okay, so do not forget that striated duct is part of the saliva. Okay, so please do not forget it. It's very important for your self-control test. So it's going to be included there. As you can see, within the connective tissue of the salivary gland, we have lots and lots of lymphocytes and plasma cells. Who remembers what are plasma cells? At least what do they do?
Make antibodies.
Very good. Plasma cells, they make antibodies. How do we call an antibody in medical language? We call it immunoglobulin, okay? IG, immunoglobulin. So what is a plasma cell? It is an activated B lymphocyte, right? So if I am a B lymphocyte, I just circulate in your blood, I'm chilling, I'm resting, I'm not going to be making antibodies. In order for me to turn to become plasma cell and make antibodies, I need to be activated. I need to meet my antigen. Once I bind to my antigen, I start to make antibodies against that antigen. So plasma cells, they are very important in your salivary gland because they're the first part of the protection, of the immune protection, right? So they will be the first ones to fight the certain pathogens that you have. This self-control test, we will learn that there are 5 types of the immunoglobulins. Okay, so there are 5 types. Which particular immunoglobulin is within your saliva? We call it IgA, immunoglobulin A. What do you need to know about immunoglobulin A? It is present in any of your secretion. Doesn't matter which kind of secretion it is, IgA will be there. Saliva is your secretion. Tears are your secretion. Sweat is your secretion. Milk is your secretion. Vaginal fluid is your secretion. Semen is your secretion. In anything that comes out of your body, okay, you will find that there is going to be IgA. Okay, so IgA will be present there. So which kind of immunoglobulin is present in your saliva?
A.
A, okay, who makes it?
Plasma cell.
Plasma cell.
Plasma cell. Very important question. What is plasma cell? What do you say?
Activated B lymphocyte.
Perfect. Okay, so everybody understands why would I want to have lymphocytes and plasma cells in my saliva? I mean, it's pretty much straightforward, right? So saliva, oral cavity, pathogens are nearby, so you definitely want to protect yourself somehow, right? So this is what you have to remember there. Okay, so major salivary glands. We have said that they're going to be 3 of them, 3 pairs, right? So 2 parotids, 2 submandibular are here, and 2 sublingual. How do you know that you're looking at a major salivary gland? It has a capsule. This is very important distinguishment, okay? So minor salivary glands do not have a capsule, but major do. So if you can kind of imagine that this is your salivary gland, let's imagine it is parotid, so I'm going to put P, right? What surrounds it is a capsule. And this capsule consists of some kind of dense connective tissue, right? And what's going to happen is that this dense connective tissue from the capsule starts to enter into your parotid. It starts to send, as we say, septa. Okay, so it starts to send septa. Those septa, what are they doing to your parotid? As you can see, they're kind of dividing it into little tiny lobules, right? So those are going to be the lobes or the lobules. So this is why you need to remember, once your salivary gland is capsulated, automatically that means that it is also lobulated. So if a gland has a capsule, it has to be lobulated. It has to have little tiny lobules. Do you understand how the lobules came? How did the lobules appear?
From a capsule.
So what does the capsule sense? What are those lines?
Septum.
Septa, very good. Okay, so septa, they come out from the capsule. Okay, so this is the capsule, those lines, those are the septa. Those septa come into the parotid gland, and what do? Divide it into the little tiny lobules. Why are those septa important to us? Because if I see septa, if I see connective tissue of septa, inside of it, there will be excretory ducts. This is very useful to identify on a slide. Excretory ducts are always surrounded by the connective tissue septa. So another way, what is the location of the excretory ducts? They're within septa. Inside of the septa, you will always find excretory ducts. Is it clear?
Yes.
Numerous lymphocytes, plasma cells, we have talked about it. Function of the plasma cells, we have also talked about it. Forgot to tell you this. How much saliva is produced daily? 1.2 liters. Okay, so this is the normal amount of the saliva that you should be making, about 1.2 liters a day.
Can you
Sorry?
repeat it, please?
Yeah, 1.2 liters the saliva is made daily. That's how much you should be making. Okay, so on the previous slide. Okay, is this picture familiar? I hope so. Okay, so last semester we have learned it. So those are the different shapes of your glands, right? So this is like compound tubular, this is the compound alveolar, compound tubular alveolar. Basically, what does it mean? We have to look at the acini. As you have told me, there are two physiological types of acini, serous and mucus. How do you know that you're looking at a serous acinus?
If it's not washed out,
So what's the color?
purple.
Basophilic, okay? So
Basophilic.
purple basophilic. So the color will be like this. Why is it purple or basophilic? We had a question like this in our quiz today.
Because of the protein.
What's up with the protein?
It
Are you making or
contains-
having it?
Contains.
Contains or are you making?
Make it.
You're making, okay? So do not forget from the last class that we have learned, if I am actively making a protein, which organelles are on fire?
Nucleus.
Nucleus, what else?
RER,
RER, rough endoplasmic reticulum, plus
ribosomes.
ribosomes. What is their charge?
Negative.
Negative. So which kind of dye would like to come and bind here? A basic dye, such as hematoxylin. It will have a positive charge, right? So this is why serous acini, they're basophilic. What is the shape of a serous acinus? When you draw it, you have to draw it spherically. You have to draw it like this, like a sphere, okay? So always, so do not forget this, okay? So serous acini, they're always drawn spherically, like this. How's the nucleus in the serous cells that you can see here? How's the nucleus? Peripheral, eccentric?
Eccentric.
Eccentric, okay? So do not forget that the nucleus, as you can see, is in the center. In each of the cell, in each of the serous cell, the nucleus is going to be in the center. How do we say it? We say it eccentrically, right? Mucus acini. This is not a good picture, but how's the shape of the mucus acini? They're more or less tubular. They're a little bit elongated, okay? So this is the mucus acinus. So this is why I make sure you understand it. Which acinus is this?
Serous.
Serous, okay? Which acinus is this? Mucus. So shape is going to be different. We have talked about it last class as well. How's the color of the mucus acini?
Like white, it's washed out.
It's pale, it's washed out by which step?
Clearing.
With what?
Xylol.
Xylol, very good. Okay, so do not forget we have discussed this last class. So during clearing with xylol and fixation as well, both of those steps can wash away the mucus that is present within the mucus acini. How are the nuclei in the cells? They're a little bit peripheral, right, and flattened because the mucus was pushing them. So what is this structure? Is it a physiological structure?
No.
No, this is the artifact of Giannuzzi. Okay, so do not forget what is another name for the serous demilune. The another name is going to be, this is the artifact of Giannuzzi. This is a mistake of a histologist. When the person was preparing the slide, he did not handle it with care, and as a result, some acini have pushed into each other, right? So we can see that the mucus acinus was pushed into the serous acinus. Do not forget that myoepithelial cells are always going to be surrounding your acini, right? So they will always be there, ready to push out, to squeeze out whatever saliva you have within this acinus, right? So now we come to the most important slide. This is a question in the oral exam by Professor Clara and Rosa. They will ask you to draw serous cells and draw mucus cells, okay? So serous cells, they are present within a serous acinus. What is the shape of a serous acinus?
Spherical.
Spherical. So what am I drawing? I'm drawing it like this. I'm drawing it like a sphere. So this is a serous acinus, right? What comes out from this acinus like this?
Duct.
Which duct?
Intercalated.
Intercalated. So we have learned today that this duct that comes out from this acinus, this is going to be intercalated. You need to remember that the serous cells, they have a very specific shape. They're pyramidal or triangular in shape. So which kind of cells are sitting within the serous acinus? They are triangular in shape. So I tried to draw it like this, right? So here are the nuclei like that. So those are the triangular looking, pyramidal looking serous cells, which are present within the serous acinus, right? Now, you need to remember, so let's kind of magnify it. So here's my serous cell. It's triangular in shape. The nucleus is going to be somewhere here. It's very spherical, very eccentric, and etc. You need to remember that serous cells, which you're drawing right now, they have two colors. We say that serous acinus is basophilic, yes, but the cells themselves have two colors. So this is very important difference. Again, how is the color of the entire acinus?
Basophilic.
Basophilic. But how is the color of individual cell? It has two colors. It is basophilic and acidophilic. Two colors. Where is the basophilic? At the base. So the base area of the serous cell, what is its color? Its color is purple. It is basophilic. But its apical area, right, the top, is going to be acidophilic. It is red. It is eosinophilic. So we need to ask ourselves this question, why? Why is the base of a serous cell acidophilic? Basophilic, pardon. Why is the base of the serous cell basophilic?
So it has a nucleus.
It has a nucleus, okay? So, Yumna, I'm reading your lips, speak up. Okay, so it has the nucleus, okay? So it actually has a nucleus right here. So what did we say? Nucleus, what is this charge? Its charge is negative. So who will like this area? Definitely hematoxylin, right? So this area right here like this will be blue. Do not forget, serous acini, what are they making? They're actively making proteins. The proteins that they're making, are they active or inactive?
Inactive.
It is inactive. So when you make the protein, at first it is inactive. When you secrete it, something in the environment of where you're secreting has to activate that protein, right? So why would I want to make something already active so it starts doing its job? No, I want to make first something inactive, and when I secrete it, whatever is present in the environment, like pH or other enzymes, will activate whatever I have made, right? So how do we call inactive protein? We call it zymogen. Okay, so we call it zymogen. Inactive protein, this is called zymogen. I am a serous cell. I'm making lots and lots of inactive proteins. Do I immediately get rid of all of them? Or do I keep some in myself for future?
Keep some.
I keep some, okay? I'm a very economical cell. I want to give everything away. I want to keep something to myself as well. So where would I keep those proteins that I'm making? I'm going to keep them in the apical area. So what was the color of the apical area?
Acidophilic.
It was red. It was acidophilic. It was eosinophilic. But do you understand why is it red? Why is it acidophilic? Because what is located here? What are those dots?
The proteins.
Say better.
Stored proteins.
Say better.
Inactive
Zymogen.
stored protein.
Zymogens.
Zymogen.
Okay, so how do you call inactive protein? You call it zymogen. So a perfect answer would be stored zymogens. Okay, so again, what is this?
Serous acinus.
Serous acinus. Serous acinus consists of epithelial cells. Here they are. What is their shape?
Pyramidal.
Pyramidal or triangular? Are they uniformly stained?
No.
Definitely not. They have dual coloring, right? They have two colors present. What is the color at the base of the cell?
Basophilic.
Basophilic. Why?
Because it has a nucleus.
Exactly, because that's where the nucleus is located. Nucleus has a negative charge. Hematoxin would want to be here. We're in the serous acinus, right? So what are we making? We're making proteins. How do you call inactive proteins? Zymogens. Where do you store those zymogens?
The apical
area of a secretory cell. So right here, this is where my zymogens will be. At the end of the day, they are proteins. So which kind of charge do they have?
Negative.
Positive.
Positive, okay? If it was negative, they will be also basophilic, right? So they will have positive charge. Majority of proteins have a positive charge. Just some exceptions have negative charge. Majority of proteins, they have a positive charge. So here's the charge will be positive. So who would want to come and stay in here? Eosin. So this is why this area is red, okay? So if Professor Rosa asks you to draw a serous acinus and you want to show off, this is how you draw it. And in the apical area, you put those dots. Then you laugh and be like, huh, what are those dots? Oh, very simple. It's just zymogens. Okay, so what are zymogens? Oh, it's just inactive proteins which are being stored right here. Okay, so this is how you would draw for a 5. Once you draw it like this, no more questions for histology. So moving on to the next part. Okay, so is it clear? Okay. Mucus secreting cells within the mucus acini. We already talked about it, that they're pale, right? And something is being washed away. What was washed away? What did we say last semester? What were you washing away?
Mucin.
We said mucin, right? So some kind of mucus, some kind of mucin. As a second-year medical student, you're going to again modify your answer. What is exactly washed away? Mucinogen. Okay, so remember this particular name, mucinogen. What is mucinogen? Mucinogen is like glycogen. What is glycogen? How would you describe glycogen? Anybody ever heard glycogen?
Sugar.
Sorry?
Carbohydrate.
It is, so it's like a stack of carbs. It is a polymer of carbs, right? So it is a bunch of carb molecules together. Which carb exactly?
Glucose.
Glucose. Mucinogen. Is it going to be a polymer of glucose? No, it is a polymer of another simple sugar, which is called mucin. Okay, so mucinogen is just a polymer of mucin. Everybody understands the meaning of the word polymer? Polymer means that you're like stocking things up together, right? So you don't just disperse them everywhere, you kind of keep them all very, very close to each other. So if I ask you this question, what is exactly washes away during fixation and clearing? How would you say it?
Mucinogen.
Mucinogen is being washed away. So that's the answer for a 5. So not just mucus, not just sugar, you have to say exactly which one. And this is the mucinogen. Okay, what will you use to stain mucinogen?
Pass.
Yes.
Talked about it last class, right? So this is going to be PAS, periodic acid Schiff base reaction. What will be the color?
Magenta.
Magenta. Okay, so don't forget magenta will be the color. Now, salivary ducts. So we have said that there are 3 types of them. There's the intercalated that comes directly from the acinus, then striated, then excretory duct, right? So excretory duct will be opening up into the oral cavity directly. Now, we have 2 types of salivary glands. We have the serous and we have the mucus ones. Serous, they have all of those ducts, all of them. So if I were to draw a serous salivary gland basic unit, I will draw it like this. Serous acinus, what comes out of it is intercalated duct, which continues as striated, a little bit bigger, which continues as excretory, a little bit bigger. But if I'm drawing mucus salivary gland, things are changing. So how is the shape of the mucus acinus? We have said it is a bit tubular, right? So it's a bit flattened, it's a bit tubular. Mucous salivary glands have very poorly developed intercalated ducts. So they'll be very little, like very, very short. Okay, so they'll be very, very, very short intercalated ducts. There will be no striated whatsoever. Okay, I know department says there are, and you can even see like one, but according to the book and the world, there aren't any. Okay, so they're so poorly developed that there aren't any striated. And lots of excretory ducts. So what is the major difference between serous and mucous salivary glands?
No striated and
So
fully
which one
developed.
does not have striated?
A mucus.
Mucus. Okay, so mucus does not have striated ducts, and the intercalated are very, very poorly developed. Do you understand why? Like, why would you not wanna have the same amount of ducts in the mucous salivary glands? Why you wouldn't wanna have it?
Because viscosity is quite high.
Perfect, perfect, perfect. So do not forget which kind of saliva is the serous salivary gland making. It is watery, right? It is very, very watery. But the mucous salivary gland makes viscous saliva, because what is this mucinogen that you say? At the end of the day, it is sugar. Think about honey. Honey is sugar. It is extremely, extremely viscous. The more sugar I have, the more viscous it is. So this is why you wouldn't want to have all of those duct system in the mucous glands for one reason, because it will clog it up, right? So it will clog up those ducts if it was too many of them. So this is why you have no striated, very short intercalated. So technically your mucous saliva just goes directly to the excretory to shorten the distance so you can get it out as soon as possible. Extremely important slide, extremely, for the oral and for the SCT. Basically, those ducts that you have here, the intercalated, striated, and excretory, they do not have only the function of conducting or transporting the saliva. They can also modify it. So if you see this option in the self-control test, do not be afraid to choose it. Ducts can modify the content of saliva, and this is correct, okay? So they can easily modify the content of saliva. What do I mean? So take a look at your intercalated duct. First of all, which kind of epithelium lines it up? This is going to be simple cuboidal epithelium. So inside of the intercalated duct, there is simple cuboidal epithelium. Those simple cuboidal cells, they possess an enzyme. You don't need to know the name of this enzyme, I just wrote it for you. But you need to know that this enzyme secretes bicarbonate into the saliva and absorbs chloride from it. So what is the job of the intercalated duct? How exactly do they modify the saliva? They add bicarbonate into saliva and remove chloride. Excretory striated ducts are also lined by cuboidal epithelium if you're closer to the intercalated. So think about it this way. Here's your striated duct, right? This is intercalated, this is excretory. Divide your striated duct into two areas. If I'm closer to the intercalated, what will be my epithelium here? Simple cuboidal. Why? Because intercalated duct has simple cuboidal epithelium. What will be the shape of the cells here? It will be columnar. So here it will be columnar, simple columnar. Why? Because I'm closer to excretory. Does it make sense? So there is not a single epithelium within the striated duct. It depends where you are. Are you closer to the intercalated or are you closer to the excretory duct? Nevertheless, striated duct also has certain enzyme, and what does it do? It also adds bicarbonate, but in addition to it, it also adds potassium. And what does it remove from the saliva? It removes sodium. So as you can see, what is the job of your ducts? Their job is to get rid of your salt. Okay, so they get rid of the sodium chloride. They get rid of it. So your saliva shouldn't be salty. So I repeat the question. Ducts, do they only transport the saliva or do they modify it?
They modify it.
They modify it. So typically you see this, okay? So is it correct to say that only striated duct is capable of adding bicarbonate into the saliva?
No, intercalated ducts also do it.
Intercalated as well can add the bicarbonate. So this was a question last year, okay? So only striated duct can add the bicarbonate into the saliva. That's false. Intercalated can do that as well, okay? Excretory ducts cannot modify, so this is very important. So there's one duct that definitely has just the job of the transportation of saliva, just conducting saliva, and this is excretory duct. They cannot modify it. It's a bit too late already. You're already dropping the saliva into the oral cavity, okay? Epithelium changes. We have different kinds of epithelium within the intercalated duct. You can see pseudostratified, stratified cuboidal, and additional stratified columnar. Okay, so additional epithelium is the stratified columnar. So all the different types. Now, this is Professor Clara's favorite diagram from the book. Okay, so she absolutely adores this diagram. So if you have salivary glands with her, most likely she will ask you to draw it. She will be like, there is a diagram in the book that compares the major salivary glands. Can you draw it for me? Just draw this, like just try to draw this. I'll explain it to you. So how do you call this? What is this?
Sinus.
Acinus, okay? What comes out of it is intercalated duct, then striated, and then excretory. How do you call this entire thing?
Salivum.
Salivum, very good. Okay, so this entire thing, this is going to be known as the salivum. So this is a basic unit of the salivary gland. This first salivary gland, this is going to be parotid. Okay, so this is the parotid, the one where your cheeks are. So this is the parotid. This one is submandibular. And which one is here? This is going to be the sublingual. Okay, so 3 major salivary glands. What do they all have in common, except for the saliva? What do all 3 of them have in common, except for the saliva? In the beginning of the class, I told you.
Striated duct.
Except for that. So except for the saliva, all except for this all area. Capsule. Okay, so they have capsule.
Oh.
So they have a capsule. So don't forget their major salivary glands. They're paired, sure, but you know that they have a capsule. Okay, so they are going to have a capsule. So here's your acinus. You can see that there is a red cell and there is a yellow cell. What's the difference?
Oh, is it serous and mucus?
Exactly. So red color is which one?
Oh, serous?
Serous. And yellow is mucus, cell. Why? Why is this mucus?
Oh, because the nucleus is on the outer.
On the periphery, okay? So the book is helping you. The yellow cell is mucus and the red cell is serous based on their nuclei, right? So you can see that the nucleus is more peripheral, then it is mucus. If it is the nucleus more in the center, then it is serous. So parotid gland, its acinus consists of which cells?
Serous.
Serous only. Okay, so your parotid gland, the one which you can see here, its acini consist of the serous cells only. You can see it's only red, right? How are the ducts? As you can see, they're all equal. So the amount of intercalated and striated and excretory is more or less the same, right? So the amount is all the same. Submandibular, which acini are dominant?
Serous.
Serous. Okay, so with a little bit of mucus. So the ratio of acini is towards serous in the submandibular. In the sublingual, as you can see, it is the opposite. Majority of the acini are mucus. Now, how are the ducts? So very important to remember that submandibular, majority of it is striated duct, majority. Okay, so majority of it ducts. I know the book is not showing it exactly, but just from the department that majority of the ducts will be striated in submandibular. How about the sublingual? Majority will be excretory. Okay, we have talked about it, that which kind of saliva sublingual salivary gland is making. It's making viscous, right? So it's making mucus, it's making viscous saliva, which is not good. How about the amount of the saliva? Which one will be dominant? Which one will make majority of the saliva? What do you think? Parotid, submandibular, sublingual, which one?
Parotid.
Everybody thinks so because it is the biggest, but no. Submandibular makes 75% of the saliva. Okay, so submandibular salivary glands, 75%. Parotid, how much will it make? About 25%. And sublingual is just 5%. So how is your saliva? Is it watery or viscous?
Watery.
Extremely, okay, extremely watery. If you have a viscous saliva, I have some bad news, you're probably pre-diabetical. Okay, so you need to go check your sugar level. It means that you have diabetes. They can ask you this weird question: why parotid does not make majority of the saliva? Like, why is that? It's the biggest, but why is it not making majority? Anybody knows? In anatomy, maybe you have already went ahead and learned. What's passing through the parotid? I'm reading lips, okay, so facial. So facial will be passing with its particular nerves, okay, so you're gonna see the 5 branches of it coming out like this, like a hand, okay, so this is why parotid gland will be filled with nerves, okay, so it'll be filled with nerves. So this is why through evolution, I don't know, whatever you want to think, the way you want to think, just it's busy already. There's so many things passing through it, so it should have been also making lots and lots of saliva. So submandibular is the one that makes. Okay, merocrine secretion, one word to replace it. In other words, merocrine.
Ecrine?
Cytosis.
Exocytosis. Ecrine, this is a sweat gland, and this sweat gland secretes through the merocrine type of secretion. Yes. Just what is the one word for merocrine? How would you describe it? It is exocytosis. What is exocytosis? You put your product into a vesicle. This vesicle fuses with the plasma membrane and then releases whatever was inside the vesicle. Why is it here? All of your salivary glands, this is how they secrete. Their type of secretion is merocrine, all of them. Doesn't matter which salivary gland you're talking about it. If they ask you what is the type of secretion for it, its type of secretion is merocrine. From the last semester, do you remember? I asked you this question in our quiz today as well. What are the 3 types of secretion? Merocrine, what else?
Holocrine.
Holocrine and?
Apocrine.
Apocrine, very good. What is the gland that is an example of merocrine secretion? Salivary sweat, right? Example of apocrine secretion.
Sweat gland.
Sweat.
Also with the same name, which is called apocrine sweat gland. Do you remember where are they located, apocrine sweat glands?
Armpit.
Yes, axilla. Okay, so axilla, anus, nipple, all those weird places. And last one, do not forget milk is also apocrine, right? So mammary gland is also apocrine type of secretion. And holocrine, an example?
Sebaceous gland.
Sebaceous glands, very good. Okay, so refresh your memory. I'll be asking you a lot about it throughout the semester. Okay. Here is this picture to show you ducts, okay? So we have different excretory ducts, they have names. So here is your parotid gland. The name of its excretory duct, it is called stensons. Somewhere else I wrote it, okay? So somewhere in the slides I wrote it, so it's just for you. So stensons, this is parotid, excretory duct. Here we have our submandibular salivary gland, its submandibular excretory duct is called Wharton's. Remember last semester, Wharton's jelly? Remember or no?
Yeah.
What was Wharton's jelly?
The umbilical cord.
Yes, it is within the umbilical cord, but what is it?
The
A type
embryonic
connective tissue.
Somebody saying something else? Prince, were you saying something?
Hyaluronon.
Embryonic connective tissue.
What's the word?
Mesenchyme.
Mesenchyme, there you go. Okay, so do not forget the name. So Wharton's jelly is present within the mesenchyme. This is the ground substance of the mesenchyme specifically. Okay, so don't forget, mesenchyme is name of the entire connective tissue. But Wharton's jelly is not the entire connective tissue. It's just the ground substance, the gags, hyaluronan, all of this, right? So the same dude. So Wharton's jelly, Wharton's duct, it's the same person. And here you have your sublingual salivary gland. As you can see, it also has lots and lots of little tiny ducts. This is very special. So your sublingual salivary gland does not have one excretory duct. It has lots of them. This is what we saw previously, right? So which ducts are dominant in the sublingual? Excretory. So it has lots and lots of them. How do we call them? We call them ducts of Rivenus. So Stenson's is coming out from the parotid. Wharton's coming out from the submandibular, and Rivenus are coming out from the sublingual. So here they are. What are those?
Mucus acini.
Mucus acini. What are those?
Serous.
Serous acini. So now let's begin our slides. So we'll learn on the slide. So this gland, this is parotid. Okay, so this is a parotid gland. How do you know that you're looking at parotid salivary gland? 3 things will help you. Number 1 thing is the amount of connective tissue septa. So all of those things, those red things that are kind of traversing the entire gland, all of them are called connective tissue septa, right? As you can see, the amount of the connective tissue septa is insane. It has lots of it, and they're very, very big. The second thing that helps you to identify parotid gland is the amount of adipocytes. Do you see those white things? Those white things are adipocytes. You can see as many adipocytes as there are of the actual parenchyme, right? Of the serous acini. So it's so many white dots are present, right? So many. What are those white dots? They're just adipocytes. So amount of adipocytes is insane. It's a lot. No other salivary gland has this many adipocytes. And lastly, the third thing that helps you to identify parotid gland is just that it has serous acini only. So if you think it has mucus, if you can see those pale things, you think, well, it must be mucus. It's not, it's adipocyte. So compare, okay? So they're all looking the same. So what are the 3 things that help you to identify parotid? Number 1, I repeat, is?
Septa.
Septa, the amount of connective tissue septa. This is connective tissue septa. This is also. Where does connective tissue septa originate from?
A capsule.
Capsule, very good. Second thing that tells you this is parotid is the amount of
Adipocytes.
adipocytes. You can clearly see that half of this slide is white. What is this white? This is the adipocytes. And the third thing is just serous acini. So let's take a look. So parotid gland, a very weird question they can ask you in the oral. They did, so that's why I'm telling you. They ask you, what is parotid gland? And of course you can say this is a salivary gland, right? But again, you're my student, so I really want you to show off with your knowledge. There's nothing wrong with showing off. It actually is good for them. You will impress them. So whenever they ask you, what is a parotid gland? What is a submandibular gland? What is this and this? There's a certain way to describe it. Take a look at the first sentence. In this first sentence, you need to know everything there is about parotid gland. So if they ask you, what is parotid gland? What are you going to say? It is an exocrine, merocrine, serous salivary gland. In this one sentence, there's everything you need to know. For example, that it is salivary gland. Which kind of salivary gland? Serous. What is the type of secretion for it? Merocrine. If it is merocrine, it has to belong to the exocrine glands, right? So this is why for the future, in your oral examination, make sure you kind of stick to it. You will see the face will change. Whenever you give them this solid, saturated with information sentences, the face changes immediately, okay? So they treat you better. What does the serous saliva consist of? Water, electrolytes, some antibodies. Which antibodies specifically?
IgA.
IgA, okay? So immunoglobulin A. Do not forget that this antibody is present in all of your secretions. But also amylase. What is amylase?
An enzyme.
What does it do?
It breaks down carbohydrates.
Very good. It breaks down it breaks down disaccharides into simple saccharides, okay? So it breaks down disaccharides into the simple sugars. Is it correct to say that amylase is only made by the salivary gland, or is there another organ that can make amylase? There's another organ that can make amylase. Anybody knows which other organ? Pancreas. Okay, so pancreas, the exocrine pancreas will also make amylase. So if you see in the ACT that amylase is only produced by the salivary gland, this is a false. Okay, so it's also made by the exocrine pancreas. Okay, dense connective tissue, capsules and septa, divides into lobules, adipocytes, lots of them. Parenchyme consists of entirely of the serous acini. Yes, serous, we have discussed how do the serous acini look like. Okay, this is important. Stensen's duct, this is the excretory duct of the parotid gland. And where exactly does it empty? It empties in the area where the second upper molar tooth is located. Okay, so upper jaw, we have two molar teeth here. Okay, so somewhere here. Right above it, if you open your cheek on the inner part, you will see a little tiny dot right in front of it. That dot is the place where the Stensen's duct opens up, okay? Merocrine, we have talked about it. This is exocytosis. So let's try. So how do you call this tissue, this?
Septa.
This is the connective tissue septa. As you can see, it is dense connective tissue, dense irregular connective tissue. It has lots and lots of weird looking collagens, right? They're all running in different direction. What is this?
A duct.
But don't forget we have 3 types of duct. So which duct is this specifically? We have talked about it in the beginning of the class. Which duct is present within the septa?
Excretory.
Excretory. Excretory. Okay, so those ducts that you can see here, those are going to be excretory ducts. They are always surrounded by connective tissue septa. Always. You will always find connective tissue around them. What are those white things?
Adipocytes.
Adipocytes. And what are those blue basophilic?
Serous acini.
Serous acini, right? So you can see that the majority, not even majority, all of the acini are serous, all of them. Okay, which duct is this?
Excretory.
Excretory as well. How do you know?
It's in the connective tissue.
This is connective tissue septa. Now, do you think that this excretory duct is the same as this one? Do they look the same?
It's a bit smaller.
It's a lot smaller. So the one that I have shown you here, where is it? It's here. Okay, let's imagine it's this one. Here they are. So is it looking the same?
No.
No.
Absolutely not. So this is why excretory ducts are divided into two. There is intralobular excretory duct and there is interlobular excretory duct. Which one is this?
Inter.
Inter, right? So inter. Why? Because don't forget, what is this connective tissue septa doing? It is dividing your one gland into several
Lobules.
lobules. So between the lobules, you will always find septa. So here is your septa. It divides one gland into lobules, right? So between the lobules, you will find septa. So this big connective tissue septa will be home to the excretory duct. Which one specifically? Interlobular excretory duct. What about those ones? There's just little bit amount of the connective tissue, so they are actually within the lobule. So what are they? They are intralobular excretory ducts. Is it clear? So which one is this?
Intralobular.
So to make it simple for you, judge the amount of connective tissue. If connective tissue is present, it has to be excretory duct. The only question is it intra or is it inter? If it is little bit of connective tissue, it is intra. If it is lots of connective tissue, it is inter. Okay, what are those?
Those are ducts as well.
Yes, which ones?
Intercalated. Or
Those are actually striated, and I'll tell you why. This and this is intercalated duct. So take a look. This is a serous acinus. Serous acinus, you can never see lumen. You cannot see the lumen. Do you see? It's just a bunch of basophilic cells together. As long as you see a little tiny hole, which by size is way smaller than the acinus itself, then it has to be intercalated duct. But how is the lumen here? Compare this picture. The lumen here is as big as the acinus itself, right? So this is why it has to be striated. Striated ducts, they have very big lumen, very. Okay, so those are going to be striated right here. These little tiny ones are intercalated. It's very rare for us to find a good picture for the intercalated duct because they're so small. Okay, so what are those?
striated ducts.
Striated. Okay, so let's try. Okay, so for example, this one, it's my favorite. Which one is it?
It's in the connective tissue, so it's intralobular.
Full name, please. Intralobular what? Excretory duct. So it's very good. You see the connective tissue, right? You see it. So it has to be excretory. Just the only question is it intra or interlobular. But still, the size is very small. So why is it my favorite? Because we caught one duct that is transitioning right now. It is actively passing from striated to the intralobular excretory one. It's right in the transition. So if we follow this duct 1 millimeter more, it will be already the normal excretory intralobular one. Okay, here it still looks like striated, surrounded by the connective tissue septa. But you're absolutely correct, because I see connective tissue septa. This is intralobular excretory duct. They put up this slide about 2 years ago, and they pointed here, and they ask you, what is this? This is intercalated. So this weird looking structure, this is intercalated duct. This intercalated duct is not your typical one. It's just its direction is different to the section. So here, for example, we can see that it is a cross section of intercalated duct, right? But here, this is going to be a longitudinal section of it. So think about it like this, like, I don't know, here's my intercalated duct, like this. It's not a cross section, it is like this. It is longitudinal section. So you can see it as a line, as a duct it is, okay? What about this one?
Intercalated duct as well.
So again, look, acinus, look how tiny. How's the lumen?
Larger.
It's a bit big, right? So the lumen is a bit big. It's as big as your sinus. So I would personally say this is striated. This one as well. Okay, so the lumens are big. Okay, so this is for you. Okay, so just for you. So we will find more. This is submandibular salivary gland. Okay, so this is submandibular. So how do you know that you're looking at submandibular salivary gland? First of all, the amount of septa. Do you see it is there, but it's not the same amount as in the parotid, right? So it is definitely there, but you do not see as much of the connective tissue septa. Like this is connective tissue septa, this, right? So compared to the parotid, it's not as much. What are those white things?
Adipocytes?
Adipocytes. Are there as many as in the parotid?
No.
It's present there. They are here. I can see them, but they're not as many as in the parotid. And lastly, what are those pale areas?
Mucus acini.
Mucus acini. Do you see now? Those are mucus acini. They're a bit darker than adipocytes. Adipocytes are like bright white. Here they're pale. So those ones has to be the mucus acini. But still, which acini are the dominant one?
Serous.
Serous. So three things again help you to identify submandibular. The amount of septa, it is there, just not as much. Adipocytes, they are there, not as much, and presence of the mucus acini. Okay, so how would you describe a submandibular salivary gland? Full name: exocrine, merocrine, mixed, right? So it is going to be mixed salivary gland, mixed salivary gland, mixed with the ratio towards serous, right? So the most abundant is going to be the serous. Wharton's, 75%, we talked about it. So white things are adipocytes, it is given. What are those?
Mucus acini?
Mucus acini, those are serous acini. So those, what are they?
Striated ducts?
Very good. So they are striated. What about those? This one, this one.
Intercalated?
Very good. This.
Striated as well?
Striated as well. This one.
Oh, intercalated?
Intercalated. Somebody else. This one.
Striated.
Striated. Right next to it.
Intercalated.
Intercalated. Somebody else.
Striated.
Are you sure?
No, intercalated because the lumen is
Intercalated. All of them here are intercalated. This one is more or less a bit bigger, so this is striated. Somebody else, this one.
Striated,
Striated. Okay, so this one.
intercalated,
Intercalated. This one.
striated,
Striated. Okay, and at the bottom, this one. Finish. Lobular.
lobular
Excretory duct. Okay, so this one, this is the intralobular excretory duct. How do I know intra? Simply the amount of connective tissue. It's not as much. Let's try again. Okay, so this one.
striated,
Striated.
What's this?
Intralobular.
It's connective tissue. Okay, so this is the connective tissue. Do not forget, what did we say? If connective tissue is present, it has to be excretory duct. So this is an intralobular excretory duct. This one, guys?
Intercalated.
It is. This is the intercalated. Okay, so here the lumen is not visible, but this, just imagine, lumen will be very big, so this must be striated, right? Okay, this one. I'm asking so much because they will definitely ask you this question. Which duct is this? So we need to get familiar. So which duct is this?
Striated.
Striated. This one?
Striated.
Striated. This one?
Intercalated.
Intercalated. This one?
Interlobular.
Intralobular excretory duct. Why? The amount of connective tissue, right? So it's not as much. Okay, this one?
Striated.
It is, it is. This one?
Intercalated.
Intercalated. Okay, so I think it's straightforward. So this is a perfect example of intercalated duct. This one, it's a perfect example. It's not smudged, nothing is happening. Look at the lumen, right? Lumen is so tiny. This one?
Striated.
Striated. Look at the lumen. It's twice the size, right? So it's twice the size of this one. So it has to be striated. So here is just also striated because lumen is collapsing here. It's like this. So it's also going to be striated. Here lumen is also like this. So it's also going to be striated. Here?
Intercalated.
Intercalated. This one?
Intercalated.
Intercalated. Those two?
Striated.
Striated. Okay, so what is this?
Of the demilune.
So this is the artifact of Giannuzzi, right? So this is the serous demilune. You can see that this is a mucus acinus, and this mucus acinus has a serous cup. It's not a very good one. This is how a normal should look like. So this is how a normal should look like, but that's the best I could find for you, so apologies. So this is how it should look like, the artifact of Giannuzzi. And here, what are those ducts?
Intralobular excretory.
Excretory. So I think it's clear, right? I think you can see the difference. So try to, like after we're done, try to watch this video again and try to kind of get a hang of it before the class to make sure that you understand which ducts are those. Okay, sublingual salivary gland is this, and there is this color. What is this color?
Magenta.
Yes, so this color is magenta. Okay, so this is magenta. So what is the color in here? It is going to be pus plus H. Okay, so this is going to be pus plus H. H was used here. Favorite question of pretty much everyone. What exactly does pus stains? Well, you know, carbs and carbs rich, but which areas? Cells, mucus, basement membrane, and reticular fibers. Can you remind me, what is a reticular fiber?
Type 3 collagen.
Type 3 collagen, very good. Can you tell me why would pus stain basement membrane and reticular fibers?
Contains collagen, which are glycoproteins.
Perfect. Those two things contain collagens. What is a collagen? Collagen is a glycoprotein. So glyco part will be stained with pus. So sublingual salivary gland, exocrine, merocrine mixed, but the ratio here is more towards mucus, right? So do not forget intercalated ducts and striated are almost gone, okay? So they're not there, they're super short. The amount of excretory ducts is a lot, 8 to 20. How do we call them? We call them rivenous, okay? So we're gonna call them as rivenous ducts. So what are those?
Mucus acini.
Mucus acini, the color is magenta. How do you know that hematoxylin was used?
The nucleus are stained.
Perfect. I can see the nuclei, right? So the nuclei are those little tiny dots. If I can see them, that means that the hematoxylin was definitely used. Okay. Now, what are those? And here as well.
The intralobular.
Excretory ducts. Okay, so those are going to be the intralobular excretory ducts. So as you can understand, the sublingual salivary gland does not have that many intercalated and striated ducts, right? So it doesn't have it. Majority of the ducts which you will find here are going to be excretory. So whatever duct you can find in the sublingual, I can guarantee you that this is going to be excretory. Okay, so what is this purple thing inside of it? This is saliva. This is the mucous saliva already inside of it. Just for you, so to make sure that you can differentiate, right? So parotid, only serous, lots of adipocytes, lots of connective tissue. Submandibular, lots of serous, little bit of mucus acini, lots of adipocytes, but lesser than in the parotid, lots of connective tissue, but lesser than in the parotid. Sublingual, this is not a good example. Take a look on ours. Almost no adipocytes are present, right? So the amount of adipocytes is very, very little compared to all other ones. Okay, we begin teeth. So first of all, first thing first, there are two sets of teeth. We have maxillary and we have mandibular. In other words, upper and lower, right? So the first half, this is the maxillary, and here we have the mandibular. The tooth itself has a crown, which is the visible part, and the root. Whereas the root is within the bone itself, right? So within maxillary or mandibular bone, in the area which we call the alveolar socket, right? So there is like this hole which holds the root itself. There are two sets of teeth, primary and permanent. Primary, another name, deciduous. Okay, so this is another name. You can see this in the SET. Sometimes they put it, deciduous set. And another name is milk. Okay, so milk teeth. I think it's in every language, it's the same. Okay, so in yours too, do you call it milk? In Russian, it's milk. In Polish, it's milk. In English, it's milk. Okay, so it's definitely like the milk teeth. What's so special about milk teeth? They have no roots. The roots that they have are not roots, okay? So it's not the true root. So it's like little tiny extension that kind of holds the tooth into a place, but it's not a root per se. Now, when do you make those teeth? When do you make primary and permanent teeth? Before you're born? After you're born?
After?
Good guess, but no, it's before. Have you ever seen, I always want to put the X-ray of a newborn baby and I always forget. Just Google it, okay? So like a X-ray of a newborn baby. The amount of teeth is like 2 sets, okay? So the lower set within the jaw is the milk and the upper layer are the permanent teeth. So all of the teeth are already within the maxilla before you are born. Okay, so before you're even born, all of your teeth are already made. How many teeth there are? There are 32 permanent teeth, right? And you need to remember that they have different like structures, different shapes. We have 2 incisors, 1 canine, 2 premolars, 3 molars. How do you count them? You divide into quadrant. So each area is divided into a quadrant. So this is your upper teeth, right? So 1/2 is here. This is the first quadrant. This is the second quadrant, right? This is the third quadrant, and this is the fourth quadrant. So how do you start counting? You start counting from the center. So this is your first central incisors. They are teeth number 1, right? So 1, 2, then canine is the third, right? Then you continue 4, 5, 6, 7, 8. So which tooth is the 8th one? How do we call it?
Wisdom.
Wisdom tooth. I think you heard my story already, those students who were with me last year, of how Yuliya went to Russia to remove her wisdom teeth. Do not go, okay? So no anesthesia whatsoever, just little tiny lidocaine and that's it, okay? So this is why forever the number 8 is associated with pain for me, because I'll never forget when the doctor wrote 8th teeth has to be removed. Okay, so 8th teeth, those are your wisdom. This is your 3rd molar, so this one. So do not forget, this is very important information. How do you count the teeth? You don't just start counting 1, 2, 3 and then you count all of them. You divide each area into a quadrant and you start counting from the center. Okay, so 1, 2, and you go like in different directions like this. This slide is more important for the oral. I can guarantee you not a single question will come from here, so you can skip it if you want it until the exam period, because in the exam period, if you get teeth, they'll definitely ask you when does each tooth erupt, right? So when does it come out? Those numbers maybe will be with us for additional 1 or 2 years. Then they're going to change it, because babies right now, they're insane. They're accelerators, okay? So their teeth already come out at the age of 4 months, okay? So 6 months is already outdated. So that being said, let's begin with a little bit of the anatomy. So as we have said, your tooth has 2 areas. How do you call the visible area of the tooth?
The crown.
Crown. So whatever you're brushing, all of it, this is the crown. The one which is hidden, right, where within the bone, this is known as the root. What is this tissue that covers the bone?
Eva?
Gingiva. Which kind of mucosa is it?
Lining.
Mm-mm.
No, masticatory. Right?
Masticatory. So this is going to be a masticatory mucosa. Which kind of epithelium is here?
Keratinized, stratified squamous, keratinized.
Very good. So this is a stratified squamous keratinized epithelium. So we have learned it last class, right? So here you will find it keratinized. There are 3 tissues which are making up your tooth. Crown, right? So visible part, its most outer layer is enamel. Everybody knows this, right? So enamel is the most outer part. The most outer of the root is known as the cementum. Okay, so the most outer of the root, this is cementum. What is making up the core of the tooth? This is known as the dentine. So let's do it again. The most outer layer of the crown, which one?
Enamel.
Enamel. What is behind enamel?
Dentin.
Dentine. In the root, deep in your jaws, the most outer layer is
Cementum.
cementum. What is deep to the cementum?
Dentine.
Dentine. So dentine is everywhere. It is within the crown and within the root. It's within the core of the tooth. The most deeper area of the tooth, so this one, this is a cavity. This is known as the dental cavity or dental pulp. Within the dental pulp, you will find some blood vessels and nerve fibers. This is why toothache is one of the worst aches after delivering a baby. Okay, so this is one of the worst ache there is, because for each tooth, there is a little tiny nerve that goes there, right? How do those blood vessels and nerve fibers get into the dental pulp? Through the apical foramen. Maybe you have learned it last semester, maybe you have not, it doesn't matter, just know it right now, that apical foramen is present in each tooth. For each tooth, there is the apical foramen. Now, how is your tooth connected to the bone? Like, would you expect cementum to be attached directly to the bone, or should there be some communicator, some connecting area? There should be some connecting area. Why? Because if your cementum was connected to the bone directly, every time you take out the tooth, you take out the bone with it. But as you know, teeth can be taken out very easily. Just apply a little bit of pressure and it will come out. So how do you call the tissue that attaches the 2 things? We call it periodontum. And periodontum is without the alveolar bone. In the book it is, in the department it isn't. Periodontum is without alveolar bone. What is periodontum? I repeat. Periodontum is a structure that connects the tooth to the bone. Okay, it connects the tooth to the bone. It's the thing that kind of stabilizes the tooth in its socket. What does periodontum consist of? Well, what is the most outer layer of the root?
Cementum.
Cementum. Outside of the cementum is a ligament. This ligament is called periodontal ligament. The amount of people which have failed because of this ligament is insane, because it's a very special ligament. We'll talk about it. Professor Rosa absolutely adores this ligament. She always asks about this ligament because it's very special. In embryo, we will learn about it, okay? But make sure that you remember it. So it's very special ligament, very special. So what do I mean? Periodontal ligament is a special type of ligament that connects the tooth to the bone directly. But do not forget that periodontum is not just the ligament itself, it's with the cementum. Cementum is included within the periodontum. Am I clear?
Yeah.
Okay, so let's do it again. So how do you call this area?
The crown.
Crown, this?
Email.
Enamel, this?
Dentin.
Dentin. Okay, how do you call this area? This is a root, the most outer.
Cementum.
Cementum, dentin. Pulp cavity, what is inside of it?
Nerve fibers
Yeah.
and
Blood vessels that enter through apical
Apical.
foramen. What is this?
the ligament, the periodontal ligament.
Periodontal ligament. Periodontal ligament attaches cementum to the alveolar bone. But how do you call this?
Periodontium.
Very good. This is the periodontium, yes. Okay, so this is the thing that is the two. It's PDL plus the cementum. Very good, yes. Now, let's take a look. There is an additional structure, the neck. In Latin, neck is cervix. Okay, so we call it cervix. But whenever I tell you cervix, for sure you're thinking of uterus, for sure. Okay, so you're thinking cervix of the uterus, right? So the neck of the uterus. So this is why a Latin name is not used. Just remember that there is a neck area. The neck area of the tooth is covered by gingiva. Okay, so gingiva covers the neck of the root. What is happening at the neck? This is where we have a junction that is called cemento-enamel junction, the area where enamel continues as cementum. So where exactly is enamel continuing as cementum? At the neck. Where is the neck? The area which is covered by gingiva. There are two types of crown. There is the anatomical and clinical crown. Okay, so here they are, anatomical and clinical. Clinical crown is everything which is visible. So the enamel which is visible. What about the anatomical crown? This is the enamel which is covered by gingiva. So this little tiny area, this, right? So do you see it? Little tiny part of the enamel which is covered by the gingiva, we call it anatomical crown. So two types of crowns, anatomical and clinical. Clinical, I repeat, is the enamel which is exposed. It's the visible part. But as you can see, enamel does not just stop here. It goes deep, right? So the part which is covered by the gingiva, this is anatomical. So let's speak a little bit about the enamel. Enamel is the hardest substance in your body. Nothing is harder than enamel. It is 98% hydroxyapatite crystals. Do you remember those crystals? Hydroxyapatite crystals. Do you remember them?
Yes.
Yeah, from the bone.
Where? In the bone. Do you remember which ossification specifically?
Endochondral.
Endochondral. Okay, so when you were making the endochondral ossification, when you were converting the cartilage into the bone, you were using calcium phosphate crystals, which were called hydroxyapatite crystals, right? So hydroxyapatite crystals, it is a form, it's calcium phosphate like this, right? Now, what is very important for you? It is 98% of this, of calcium phosphate, of hydroxyapatite crystals. So is it organic or inorganic?
Inorganic.
Very good. Because in order to be organic, what do you need? Carbon and hydrogen. Okay, you need carbon and hydrogen to be organic. So this is the chemistry in the BMC. Okay, so we have learned it, but it's okay, nobody needs it. So carbon and hydrogen, those are the things which make you organic. Enamel, 98% of it is inorganic. It's calcium phosphate. So is it a suitable environment for living cells?
No.
Definitely not. So you need to remember that enamel is acellular. It has no cells there whatsoever. None. Is it vascular?
No.
No, because what do I need blood vessels? To supply cells. Are there any cells? No, so no need for blood vessels. So it is avascular, acellular structure, the hardest. But agree with me, somebody had to make it. Yes, there are no cells, but somebody during embryological development had to make it. There are cells which are called amyloblasts. We'll talk about them next class. Amyloblasts are present during embryological development. Okay, so when you were an embryo, within your jaw, you had lots and lots of amyloblasts. And those amyloblasts make enamel. Can you tell me, ameloblast, will it come from which germ layer?
First one.
What's the first one?
Ectoderm.
Ectoderm. Okay, so ameloblast will come from ectoderm. Why?
Because it's communicating with
Outside
outside.
world. Enamel, which it is making, has to be communicating with the outside world. So definitely it's going to come from the ectoderm. Okay, now we come. Is it clear until this point?
Yeah.
Now, pardon my French, let the shit begin. Okay, so sorry for this, because now we start the weird thing. So enamel, it's the hardest thing there is. It's the hardest thing. Ameloblast makes this enamel. So when you were an embryo, for each of your tooth, you had ameloblasts. Those ameloblasts, did they just throw enamel everywhere? Like you get enamel, you get enamel, you get enamel, like Oprah, you get a car, you get a car. So ameloblast is also you get enamel, you get enamel, everybody gets enamel. Or ameloblasts really are very, very meticulous kind of cells. So they put this enamel into little tiny brick, and then they put another brick right next to it and another brick right next to it. So you see what I'm going, right? So ameloblasts will definitely use a brick-like structure. Everybody knows what is a brick? No? Brick is this little cement that you use to build a house. Brick-like house, do you know? Like in Asia, maybe you don't use bricks because, I don't know, maybe there is nothing with the cement, but definitely in Russia, in like Middle Eastern area, cement, like it's one of the most important things. So this is why you use the bricks to make the, you use the cement to make the bricks. It's basically shaped like this, right? So this is your bricks and you put them together and you have a really nice house that can stay for a really long time. So why am I telling you this word, the brick? Because ameloblast also makes a brick that consists of the enamel. But this brick has another name. It is called rod. So the unit of enamel that ameloblast makes, this is called enamel rod. And enamel rod is not shaped like a brick. It isn't. This is how it's shaped. It's shaped like a keyhole. So if you see this in the self-control test, and you will, keyhole appearance. What are they talking about? They're talking about individual enamel-shaped brick. Okay, so the brick that is shaping the enamel. How do you call it? You call it enamel rod. So if I am ameloblast and I'm building my enamel, what am I using to build it?
The rods.
The rods. I'm using enamel rods. What is the shape of the enamel rod?
Keyhole-like.
Keyhole-like. The last thing here is lines of Retzius. They're also going to ask you, what are the lines of Retzius? So take a look. Here's your enamel. Below it is dentin. Do you see within the enamel during sectioning there are lines, like this is a line, right? And this is a line, and this is a line. Those are the lines of Retzius. What are the lines of Retzius? Take a look at your rods, right? So I put my rod here, 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 here. There are lots of rods next to each other, right? Lots of them are next to each other. And then I make a section. How will those rods look like? They will look like a line because they're all next to each other. So what are the lines of Retzius? They are striations of enamel rods. They're striations of individual blocks of enamel. Does it make sense?
Yeah.
So let's do some question. Who makes enamel?
Ameloblasts.
Where did ameloblasts come from?
Ectoderm.
Yes, don't want to hear from Nandan anymore. So when is ameloblast making enamel?
During embryonic life.
Perfect. Don't want to hear from Michal anymore. So what exactly is ameloblast doing? I am ameloblast. What am I making?
Yuliya, can you repeat again? The previous,
Yes, which question?
the previous answer.
What was the previous answer? I was thinking about something else, sorry.
Um,
What was the previous answer, Michal? What did you say?
When,
Embryo?
when the
Okay, so when am I making enamel? I make enamel during embryological development. Yes, I'm ameloblast in embryo. I want to make enamel. So what am I making first?
Rods,
Very good. What is the shape of the enamel rod?
keyhole shape.
Keyhole shape. What am I doing to those enamel rods? I keep on putting them on the top of each other until I fully made enamel. I am born, I'm growing up, somebody takes my tooth and slices it up. Okay, it makes a section of it. So what would you see within enamel?
The
Striations.
You see lines of Retzius. What are lines of Retzius?
The
Striations of
the enamel rods.
enamel rods. Good. Okay, last thing for today, I'm gonna let you go. So, cementum. We said that enamel covers the crown. What does cementum cover?
the root.
The root. Cementum is identical to bone. Its composition is the same. It is 65% calcium hydroxyapatite crystals, the same thing. So this is why cementum contains cells that look like osteoblasts. How would you call them? You call them cementoblasts. In bone, we also had osteocytes. In the cementum, how would you call it? Cementocyte, right? So it's identical to bone, so the cells will be the same. However, there's one major difference between bone and cementum. What is that? Identical to bone, yet there is a difference. And actually, it is the same difference as with cartilage. What's the difference between bone and cartilage?
The type of collagen, 1 and 2.
Very good. What's another?
Vascularization.
Perfect. Vascularity. You need to remember that cementum is avascular. Even though it has cells, it is avascular. Bone is vascular. Cartilage, avascular. So that's why I put the cartilage here, right? So it's the same difference. Okay, so quickly, cementum, 65% calcium hydroxyapatite crystals. We have discussed it. It is the same amount as in the bone. The cells are similar. The only difference between cementum and bone is that bone is vascular, cementum is avascular. A little bit of a Histo 1 question here. So would you find cementoclasts here? If it is similar to the bone, would you find cementoclasts or no?
You would, if it's similar to bone.
So I say it's not there. I need to tell me why is it not there.
Because
And
you want
not
to
the big
preserve.
picture, because you don't want to dissolve the cementum, like the actual reason why it's not there. In order to answer this question, you need to remember how did the osteoclasts come to the bone?
Oh, through the blood vessel.
They came with the blood vessel. You remember? It was conversion of the cartilage to the bone, right? We had periosteal bud invasion. Periosteal bud invasion included blood vessels plus osteoclasts, because what is an osteoclast? It is a macrophage. Macrophage comes from monocyte. Where is monocyte? In your blood. So in order to have the clast cells, you need to have blood. So I repeat the question. If they ask you this in the oral, why there couldn't be any cementoclasts? Because cementum is
Avascular.
it is avascular, so there's no way it will be there. And last thing for today, I'm gonna let you go. Sharpie's fibers. They always ask about it. Every histo-ECT, you will find a question about it. Okay, so Sharpie's fibers. What are those? So basically, we need to understand the following. Why every time I bite the apple, my teeth stay in my jaw and not in the apple? That's the question. Okay, I kid you not, Professor Anto. Why every time you bite the apple, your teeth stay where they are? They're not in the apple. The answer is Sharpie's fibers. Okay, so the answer is Sharpie's fibers. The reason for that is them. Basically, think about it this way. So take a look where we are, right? So what is this? How would you call this? Take a look, cementum and PDL. This is the
Periodontium.
This is going to be the periodontium, right? So this is the periodontum. Now, we need to understand how is the tooth connected to the bone. Within the periodontal ligament, we have collagen fibers. Those collagen fibers come out from the periodontal ligament and hook the cementum. Okay, they hook the cementum. The same collagen fibers come out from the periodontal ligament on another side and hook the alveolar bone. How do we call those hookers? We call them Sharpie's fibers. Okay, so we call them Sharpie's fibers. So do you understand what's happening or not really? So think about it this way. I am the PDL, right? So I am the PDL. On one side of it, what do I have here?
The bone.
The bone, sure. Let the bone be here. What is here?
Cementum.
Cementum, because I am the PDL, right? So cementum, periodontal ligament, bone. What are my fingers?
Sharpie's fibers.
Sharpie's fibers. Okay, so Sharpie's fibers are my fingers. They're literally hooking into the two areas like this and making sure that everybody is safe and sound, right? So everybody is hooked to each other, and there's no way that every time I put a little bit of pressure, my teeth just go out of my jaws. So very important, Sharpie's fibers. Where are they located?
In the periodontal ligament.
No. Where are they located?
Inside the alveolar bone and cementum.
Perfect. Sharpie's fibers, they're in the cementum and in the alveolar bone. But to who do they belong, those Sharpie's fibers?
Oh, to the periodontal ligament.
To the PDL, to the periodontal ligaments, my fingers, so they belong to me. Okay, so those are the periodontal ligaments, collagen fibers. And last question, which collagen would that be? Which one? The thickest, baddest, most
Type 1.
strongest collagen? One. Okay, so collagen type 1. So Sharpie's fibers, they're made out of the collagen type 1. Okay, so we're missing about like 10-15 minutes. I will add them to the hour classes. Okay, so in the hour classes we will do like more than today. So I will give you the recording. Okay.